delusion of control. As I've said earlier, they believe that one action or thought are controlled by another external person or force. The next one we want to talk about is changes in communication. Under changes in communication, we have thought blocking. Thought blocking is by stopping in a mid-sentence as if they are stuck. As they are talking, they just stop in a midway, showing that they are being stuck somewhere. The next one here we have, under changes in communication, we have tangential communication. Tangential communication, whereby they clear and wander from one point of one topic to another. The next we have circumstantial communication. Patients bring up details that are irrelevant to the topic at hand. The next one here, we want to know about disorders of emotion. Under disorders of emotion, say many schizophrenic patients demonstrate inappropriate affect. Under inappropriate affect, we have what we call inconjugacy of affect. The client may smile or laugh while relating a history of having been abused as a child. Or the client may become angry and anxious while asked to join a group of other clients for dinner. The next one, under still disorders of emotion, we have blunt affect. A marked decrease in the variation of intensity of emotional expression. This is called blunt affect. The patient may experience or express joy, sorrow, or anger, but a little intensity. That is the description under blunt affect. We also have here, still under disorders of emotion, we have flat affect. This is a total lack of emotional expression in a vertical and non-verbal behavior. The clenched face is impressive, and the voice rates and tone are regular and monotonous. When you go to the psychiatric hospital, you see some of these signs and symptoms, and also reflect to your books that yes, this is what is happening, and we have talked about it. We also have another symptoms here which has to do with andonesia. This is the inability to experience or to imagine a pleasurable emotion. This inability is very distracting, very disturbing to patients, while they are aware of how they differ from other people. The next disorder we have here is disorder of violation. This is delusional conflict. Delusional conflict in schizophrenia is probably due to biochemical alteration in the brain that makes it difficult for client to take in and synthesize and also respond to information. Common ones are echolalia, echologelia, echoloplexia. So when you get your dictionary, you know some of these terms that they are using. We have used it so many times, and we have talked about them so many times. So the next disorder here we have behavior. Motor behavior disorder. This is where motor behavior is aimless or destructive. The following can be observed. Here you have waxy flexibility, where the patient can stand in one place for a very long time in a stylish way. We also have stupor. The patient might hold the body still and unresponsive to the environment. Maybe thinking, when you see that, you think that, oh, something terrible must have happened to this patient. And that is the drama sometimes they put up for you to be frightened. So as a psychiatric nurse, when you see that, you know that this is a character that is part of them. And that will lead us to management of schizophrenia. How do you manage schizophrenia? With or without treatment, the patients may recover sufficiently to resume normal life, although not quite as he was. Number one, treatment or management. We have physical needs. This patient needs personal hygiene, adequate nutrition, weighing of patients, also to know how they weigh, because most times they don't tend to eat. They starve themselves. They don't even want to near food. So you have to force them, and also check their vital signs to know if they are running temperature. The second need, they need psychological or personal needs. This patient must be called by his name always, so that for them to know that, oh, they belong to somewhere and the people knows them. They must be laughed at. Always go close to them, laugh with them, and show them that you care. Guarantee sense of belonging or security. Show them that you care, just like what I have said before, and they'll be happy that you did. Number three, we have conservative energy. Conservative or conservation of energy. When one knows what a patient can do and what he can't do, basing one's decision on the knowledge of the disease and the study of man. This helps conserve the patient's energy. It helps recovery and also helps carrying out professional nursing care. Example, laughing might be a burden for a cardiac patient, whereas it is what is wanted in a patient that is moody or sad. So sometimes you use some of those things to deal with your patients. That will take us to the next needs, which is the social needs. What are the social needs? Human beings are social animals. They are animals that need companionship. They are also animals that need relationship. Patients should be allowed to be visited. You can ask their relative to visit them, and when condition permit, should go home on parole. Parole is also a period where they are being given days, depending on how their condition is, to go for holiday, maybe for 2 weeks. And then when they go there, they will observe how they behave. And this is also the time the social worker will follow them up to see how they are being treated at home, because most homes are horrible. And that will make them break down and relapse, and then try to come back again to the hospital. So under social needs, you should be encouraged to partake in debates, singing, group recreational activity, and that will also help divert his attention to know that, oh, people around him also care. Another need that the patient needs is chemotherapy. What do they need? They need drugs. And we have drug of choice, which is Lagatil, phenobarbital, and other drugs of choice prescribed according to doctor wish, and the condition of the patient also matters a lot. The least here need is physical therapy. In physical therapy, we have what we call ECG, which is often used especially to depressed patients and also manic patients who are too excited. This is also done for selected cases according to the physician prescription, which I have mentioned before. Thank you. The next thing we have here, we have sexual abnormality or problem. What is sexual abnormality? This can be defined as a sexual behavior which is not culturally accepted in the society. We have types. There are different types. We have exhibitionism. This is sexual satisfaction from one genital exposure in public. It's always man and display his penis for others or more women to see. Also have here voyeurism. We have transvestism. We have sadism. We have pseudophilia. We have fascism. We have bestiality, and a host of them. There are so many types which you can say them in the textbook so that you can then understand them very well. So any questions under it, you may ask. We have the causes, we have complication, and all of that. And that will lead us to the end of this lesson. Thank you all for listening. God bless.